The opinions expressed on this program are solely those of the individual participants and do not necessarily reflect the views of either Spectrum Generations or Time Warner Cable. Mature Lifestyle is made possible by Knowlton Hewins Roberts Funeral Homes and Cremation Service. Our homes are warm and welcoming, and we take care of you and your family like we would our own. Call us anytime. We are here for you.
Welcome to Spectrum Generations Mature Lifestyles. My name is Carrie Doherty, and we're here today to discuss Women's Health Month, Go Red. With me is Judy MacKenzie, an RN, BSN, welcome, and she is the Women's Health Navigator for MaineGeneral Medical Center. Also here today with us is Dr. Dervilla McCann, cardiologist and longtime volunteer for the American Heart Association.
Thank you, Carrie.
So thank you for being here today.
Thank you.
Judy, tell us a little bit about exactly what it means to be a Women's Health Navigator. That's a new title to me.
Yes, it's relatively new to me as well. I've been doing it for approximately 5 years. And the objective was to have someone that a woman could connect with to help them navigate through the healthcare system. It's always complicated if they get a new medical diagnosis and they need some help to find out where to go or what their resources are. Then they can call me privately, confidentially, and I can help them navigate through the system.
You're located in Augusta, Waterville, both? Where's your service area?
Right. I work for MaineGeneral Medical Center, and we have locations in both Waterville and Augusta. So my services meet the needs of the women in our Kennebec Valley, both Waterville and Augusta.
Are women referred through their medical provider, or do they call you personally? How do they connect with you?
Either is an option for women. If they want to call me privately, there's no fee attached to my services. And again, a lot of my first conversations are with women over the phone. But I also have many primary care providers refer women to me because one of the programs that I coordinate is the urinary incontinence program at MaineGeneral Medical Center.
My next question. I was wondering about the kinds of issues that people seek you out for, and I'd read that is one of your specialties. So.
Yes. Urinary incontinence is probably the topic that I discuss with women most often. But if they're looking for a new primary care provider or they're new to the area and they need an OBGYN doctor then I can get some information about the type of provider that they're looking for and get them connected to a provider that hopefully works for them. I have had calls for women that have had certain new diagnosis and they want more information about that particular diagnosis. Again, I can help them, point them in the direction of resources.
I think that's probably a difficult issue for most people most women to bring to anybody. There's a certain stigma or kind of an embarrassment almost that goes with it.
You're talking about urinary incontinence?
Yes.
Yes, indeed. We have a conversation that's private and confidential, again, over the phone, and I provide them with a certain amount of information, education about the topic. A lot of women feel that it's something that is normal with age, that occurs as we age, and there's nothing that we can do about it. But there are treatments out there, depending on the symptoms and the type of urinary incontinence that they're suffering from. So I'd like to give them the information, and then it's their choice. If they choose to seek further assistance with a specialist evaluation or further evaluation with their primary care provider who can also help them with the problem, then I guide them in that direction. I'll attend appointments with them, again, to be an advocate in the office. It serves sort of as a liaison between the patient and the physician. And generally, it's a win-win situation for everybody. They get the information they need. I think women often feel a little more comfortable, and I think it worked for the providers as well. They have someone that can reinforce their recommendations, because as we know, we get into the doctor's office and that white coat syndrome makes you forget everything that has been discussed during that time frame. And again, I can reinforce that with women and be there as their advocate.
Do you find in general that most women are pretty knowledgeable about their resources? I noticed a comment that you made when I was reading some of your background about women's personal responsibility as the coordinator of care in a family unit.
I think it's not uncommon at all for women to put everybody else before themselves, the needs of themselves. They are moms, they're wives, they're daughters, they're sisters, they're workers, and all those things become more important than taking care of themselves. So we at MaineGeneral, and I think everywhere amongst the state healthcare providers, try to encourage women to take care of themselves so that they can be the better mom, wife, friend, co-worker, take care of their health, know their health, and it only makes them a better person all around.
Dr. McCann, I know you're a cardiologist. I'm also aware that you're pursuing your public health master's degree at Harvard.
Right.
How did you initially choose cardiology, and where has that taken you in the course of your career?
I was a general internist for 3 years. I was a Navy physician at that time. And I found the field of cardiology to simply be so fascinating, very fast-paced, and it had going for it both diagnosis and very intimate personal connection with the patient, then an intervention, and then long-term follow-up. So you took care of a patient across a whole arc of their lives, from the time they first learned, or often you were the person telling the person, the patient, of their diagnosis, and then you were really able to stay with them through that entire experience of going through sometimes procedures or sometimes a surgery, sometimes a medical therapy, and you stayed with them. So and the results were usually very dramatic, immediate. So I loved the pace of cardiology as well as the spectrum of disease.
It seems to me that I hear more and more now about women and heart disease and the risk. Has that changed in the course of your career? Because as I think back, I always thought of heart disease as predominantly something that was a men's problem.
There's been a difference, a shift in perspective, and I think more awareness, thankfully. Heart disease has always been the #1 killer of women since I joined the profession of medicine. And we, I think as people in the United States, are presented daily with new things to worry about. Often they're things we don't have control over, whether it be a war or Ebola or the weather, global warming. But this health issue is something that we really do have a lot of control over. But it's a chronic problem. It's hard to grab people's attention and make them think about it because there's so many other things that we worry about on a day-to-day basis. But heart disease in women has been a focus of my practice for a long time once I realized that women dramatically underestimated their risk for the problem.
I read the statistics getting ready for today's program, and it's really eye-opening to realize how big a concern it is for women as they face so many challenges. You hear about cancers and things, but really it is heart disease that is our priority in getting that message out there.
It's the #1 killer. It's also the #1 killer of men. But what's interesting is recently death rates in men have fallen. And so now there's been a shift. Actually, more women die of heart disease every year in the United States than men. And we're not entirely sure of why, all the reasons why this shift is occurring, although we think better drug therapy is partly responsible. And we also think that smoking cessation programs have been very successful at getting younger smokers to never start smoking or to quit. So I think we've had some lifestyle changes in America that have helped both men and women, but interestingly, they seem to be helping men more than women. Women also tend to get heart disease at a later phase in their lives. So they're often postmenopausal, 60s, 70s, and heart disease and of course stroke sort of go hand in hand. They're both problems that affect the blood vessels. But they're still a very major problem in women, and it's very important that we get that word out. And my hat's off always to the American Heart Association and their Go Red campaign. I thought it was a brilliant idea when they partnered with Macy's a few years ago to make the red dress the symbol of heart disease in women. I think it's catchy.
It does get people's attention, and you both were thinking about that as you got ready today, obviously. Yes. It is February that is the Wear Red for Women's Month, I believe, and the American Heart Association always reminds us of that. But isn't there a particular date in the month of February? It's not right in the back of my
It's usually the first Friday of February, and it's Wear Red Day. And I've given presentations to the state legislature on those days in the past, and it's been heartening, no pun intended, to see that the whole audience is all dressed in red. Men often will wear red ties as a sort of a sign of solidarity. It's a lot of fun, but it's also a terrific unifying moment that helps us all reach out to one another and think a little bit about what we can do to manage our risk for heart disease.
Do you see women coming to you in your role as Health Navigator looking for information on heart disease or on resources?
Less often do I have women who seek me out, but one of the roles that I do play as the Women's Health Navigator is to represent MaineGeneral in the community at women's health activities events. And it's there that I will have women that come to me in the public and ask me some questions about heart health. We try to provide them with some basic information about risk factors for heart disease and what risk factors people can make a difference or change. And certainly there are some risk factors that are not something that you can change. And I'm sure, Dr. McCann, you have more information about those.
What are the common risk factors or the common symptoms that women should be aware of?
Well, the risk factors that we know include smoking, high cholesterol, a family history of early heart disease, diabetes, and of course, did I mention smoking? It's my number one. It's my number one enemy.
Smoking.
Additionally, we know that obesity and inactivity increase your risk for symptomatic heart disease. So those are the major risk factors. In New England, there's genetics we're starting to understand the role of genetics here, particularly in the Franco-American community, where there is a gene that appears to be inherited in a much larger proportion than ordinary. So that's a group.
We'll come back to this in just a moment. We need to take a break, so thank you for being with us, and break time.
Spectrum Generations. Live healthy, live well. Get answers, get connected. Spectrum Generations, specializing in the art of aging.
Life should be celebrated. It's a special day when family and friends gather together to celebrate the life of a loved one. A celebration of life helps us honor our loved one and keep our memories alive. Whether you're planning a traditional funeral, a creative celebration of life, or a blend of both, at Knowlton Hewins Roberts, we are truly committed to meet the personal and unique needs of you and your family. Knowlton Hewins Roberts. Visit us online or visit our 2 locations in Augusta and Winthrop.
You're watching Time Warner Cable Community.
Welcome back to Spectrum Generations, Mature Lifestyles. We're here today talking about women's health and going red for the American Heart Association. My name is Carrie Doherty, representing Spectrum Generations, and with me here today are Judy MacKenzie, RN, BSN, Women's Health Navigator for MaineGeneral Medical Center, and Dervilla McCann, cardiologist and longtime volunteer for the American Heart Association. We were just beginning to talk about the risks associated with heart disease and women. Can you identify those risks for us today, or the common factors, Dr. McCann?
Sure. We know that cigarette smoking, high blood pressure, high cholesterol, and an early family history of heart disease, usually before the age of 50, are very major risk factors for the development of heart disease. In the New England region, we also have a high proportion of Franco-Americans, and one of the things I noticed when I first came to the New England area to practice cardiology was how many young patients I was seeing who had heart disease with no particular reason other than extremely high cholesterol levels. And when I looked into it, I found that there's a subgroup of Franco-Americans who appear to have inherited a gene. The problem is called familial hypercholesterolemia. It's quite a mouthful, but that gene is present in our community in Maine, New Hampshire, Vermont, Massachusetts, in a much higher proportion than most of the rest of the world.
Oh, that's interesting. I wasn't aware. And women often don't recognize their symptoms, or they blame symptoms that could be heart-related on simpler, easier to live with causes. I think we all like to try to ignore those kinds of things that might be red flags. Judy, can you describe for us some of the red flags that women should be aware of that might be symptomatic of a heart problem?
I think you're referring to a heart attack. If women is experiencing a heart attack, sometimes their symptoms can be a little bit different. The number one symptom of a heart attack for men and women is severe chest pain in the center of the chest. Mm-hmm. There's no question there. But sometimes women will experience an extended feeling, and Dr. McCann, please help me here, of tiredness or lethargy for up to 1 or 2 weeks prior to actually experiencing a heart attack. So that's something I think that women should be well aware of. Given that they can't explain it by an overexertion, they just hiked a mountain, or they just renovated their home from head to toe, whatever, but something that they just can't experience. Nausea and vomiting, too, can be more common for women than for men experiencing a heart attack. Pain that's deferred to the jaw or the shoulder, the back. I had a woman tell me one time that she was wrapping Christmas gifts, and what happened to her, she had this terrible pain in her hands, and she couldn't use her hands like she expected that she could. And that was the most memorable symptom that she had for her experiencing a heart attack at that time.
I think the word pain is often a barrier to understanding. Most medical professions use the word pain, and we expect the patients to understand what we're talking about. Many of my heart patients come to me and say, it's not a pain, Dr. McCann, it's a discomfort, or it's a sensation, or it's a heaviness. So the word pain that we use in the profession isn't always the word that the patients themselves would use to describe this odd, funny sensation that's more usually described as a pressure. But you can also have shortness of breath. Nausea and vomiting, absolutely, can be an associated symptom with having an acute heart attack. And so those are, that gets in the way sometimes when people are trying to make the right move at the right time, get to a hospital if they think they're having a heart attack. They'll just assume that they've got an upper respiratory infection or indigestion, or I'm just tired because I'm under a lot of stress, because we're all under a lot of stress almost all the time.
And stress is a factor. It increases your risk, as I understand. It's curious to me that women and men sometimes can have a heart attack and not know it at the time, and that it's diagnosed after the fact. So the symptoms and the onset seem to be very individual, and not always severe enough to be recognized for what it really is.
That's a really good point. You're exactly right. And a number of people will find that they've had a heart attack based on a routine office visit and an EKG that's changed. Or they've just not been able to have their usual PEP for a couple of weeks, and they go in for a checkup and things are really different. So yeah, there is a group of individuals who will have no symptoms of any kind, particularly diabetic patients. They're often the group that has the most silent heart problems.
I think TV has portrayed a heart attack as something that comes on very suddenly and very dramatically, and
Right.
I think our experience says that it's not always that way.
Correct.
And yet early treatment and follow-up is critical to your recovery in a lot of cases. And I think your personal lifestyle too, I'm a wellness advocate. Can you talk to me today about the impact of healthy habits, healthy choices on our overall well-being, and can that help us avoid heart disease?
Certain individuals with genetic predispositions need more than lifestyle change, but they need lifestyle change as well. I think personally that my role as a physician in determining someone's health outcome, I may play 10-15% of that ultimate outcome, a role in that ultimate outcome. Really, the individual's lifestyle, their diet, their exercise level, and the way they live their lives has a much greater impact on how healthy they're going to be. I personally feel that knowledge is power, and the more people know about what their risk is and what to do about symptoms when they occur, the more likely they're going to get definitive care very quickly, very effectively. In the case of an acute heart attack, if you move quickly, it is life-saving, it saves muscle, it will change the trajectory of the rest of your life if you get into a hospital quickly, particularly a hospital that has services like angioplasty to open up a blocked vessel. So the whole time is muscle strategy that informs cardiology is an important thing for us to communicate to patients.
And there is recovery after a heart attack. I think TV is also portrayed it as being sort of like the end of the road and completely disabling in a lot of cases, but that's not always true. There is a regime that helps you regain very much your former lifestyle, and maybe not 100%, but there's great strides now in treatment.
And cardiac rehab, and Judy, you can talk about this as well, plays an enormously important role because there's the physical injury and there's the physical damage, but there's also the psychological aspects of having had a heart attack or any heart problems. It creates tremendous anxiety amongst people. It's very important that you deal with the emotional impact of a problem like heart disease, and cardiac rehab and a change in lifestyle following something like this can make an enormous difference. Many of my patients tell me a year after their heart attack that they feel much better now, a year later, than they did in the weeks before they had their heart attack because of lifestyle changes that they've made.
And I think it's important really for women overall to again, we started this discussion charging women with knowing their health and taking care of themselves, know their numbers too. Do they know their cholesterol levels? Do they know their blood pressures? Those are important things that women really, and men too, of course, need to take charge in doing. And talking about some of these, number one, symptoms, if you're not feeling good, having somebody that you can confide in, be it your care provider, but even a good friend or a sister, someone that you can share your concerns with is really important to overall well-being, of course, along with exercise and diet. But again, with a friend doing some of these lifestyle changes, I think it makes it easier and more successful for people.
And in your role as Women's Health Navigator, you have those resources and can direct people out to some of the programs offered by MaineGeneral or surrounding communities?
Absolutely. I'm sure there are many wellness programs available throughout the state that can help women pre-diabetes classes, living with chronic pain, living with chronic health conditions. There are these programs, again, in a group setting that, sometimes help you get through those tough times.
Smoking cessation.
Absolutely.
Really a big
Thank
one,
you.
and
Yeah.
we really need to hammer that home. If they can possibly get people to stop smoking, it's a critical step in their health.
And the American Heart Association, we need to give them credit because they are the contact and have those resources. They've done the research. I understand you're doing research along those same lines,
Yep.
directly related to heart disease and genetics and heart disease. And they do a fantastic job about getting the message out nationwide, raising awareness, and helping us all be a little more conscious, a little more responsible in how we take care of ourselves. And it's important that we share it as much as possible, too, with friends, family, neighbors. Spreading that word is probably as important as living healthy, just making people aware. So let's talk a little bit about sleep as a factor. And again, I bring that question up because it's an interest of mine. I find that lots of people today cut themselves short. Our lives get busy, and from shift work to just the stress levels to having too much to do. How much is the amount of sleep we get, or sleep deprivation, a factor in heart-related issues?
Well, it depends a little bit on why you're sleep deprived. I'm going to take the opportunity to say that one of the least diagnosed important illnesses that affects this community is sleep apnea. People stop breathing, or the snorers in particular are obstructed, their sleep is obstructed. Sleep apnea is definitely associated with cardiac rhythm abnormalities and can be associated with other more serious cardiac problems. So that's a diagnosis that we're working on to try to make people more aware. Lots of women have husbands who snore, but a fair number of husbands have women, their wives who snore too. And it's not always a benign condition. Sometimes if you notice that your partner is not breathing in the middle of the night, that's probably sleep apnea. And that is something that needs to get diagnosed and treated.
So sleep is right up there as important as other healthy habits, but what we eat, our exercise level, and our general awareness of our risk factors and what we can do to prevent. I want to thank you both for being here with us today on Spectrum's Generations Mature Lifestyles, talking about women's health issues, sharing that with the community. Judy MacKenzie from Maine Medical Center, thank you, and Dr. Dervilla McCann, thank you very much.
Thank you for having me.
For being with us.
Thank you. Thank you.
On behalf of Spectrum Generations Mature Lifestyles, thank you for being with us today. Please reach out to Spectrum Generations. We can help connect you with either of these women and the resources that they have to share.